All right, so bring that mask over here, right? Hey, yo, check it out. That's a yummy cake. Listen to me, or I'll say it fast. I can't take a bite if I put on my mask, but it's okay because you heard me. You go on a journey. You don't want to catch those sticky journeys.
No, I need a bit of that.
Yes, to keep you safe. You gotta cover your face. Anytime you go outside in the place, you gotta be safe. Was that a bird? That was cool. She's a good girl. She does so good in school.
For one name at home, I can't wear a mask. I can't be sick. I need to know not wear a mask only at like school
or stores.
Stores.
That's true. Keep your social distance. Listen to the rhyme just for instance. Thank you very much. Don't forget to wear your mask on your nice little smile. That was Sully and Daddy Freestyle.
Yeah.
Peace out.
Beans, y'all. I'm Andrew Defy, a.k.a. the Gorilla Poet Laureate, a.k.a. the Hoodie God, a.k.a. Spitting Quarantino, a.k.a. I wear my sunglasses at night inside because my eyes are as sensitive as my heart is, y'all. And we are back with another episode of Masked Up, the internet's favorite community health live stream. And we've got another big episode for you tonight. In Rona news, we are going to be talking about Pfizer's development of a COVID treatment pill and how that is going, as well as taking a dive into children's immune systems and how they are specifically equipped to fight off this virus. We are also going to take a look into the ways that working from home was a respite from racism for Black Americans and cover California's race against climate change. As if that wasn't enough, y'all, we have one of the biggest guests we've ever had on the show tonight. That's right. The director of the California Department of Public Health, Tomas Aragon, is on the show tonight, and we'll be talking vaccines, boosters, and his possible involvement with the Illuminati tonight on the show. Stay tuned. It all starts now. So the vaccines seem to be working the way they were designed to, keeping a lot of people out of the hospital. But what about the people who end up in the hospital? We've heard talks of antiviral medications being developed throughout the pandemic, but one of the companies responsible for the vaccine recently announced they are ready to start testing their COVID pill.
What if coronavirus could be prevented with a pill? Pfizer said on Monday it has started testing an oral antiviral drug for people exposed to COVID. In a mid to late stage study, Pfizer will test a pill in up to 2,660 healthy adults aged 18 or older. Participants in the trial must live in the same household as a person with a confirmed case of coronavirus. The antiviral pill is designed to block the activity of a key enzyme needed for the coronavirus to multiply. Pfizer and its rivals, including US-based Merck, have been racing to develop an easy-to-administer pill for COVID-19. To date, Gilead Sciences' intravenous drug remdesivir is the only approved antiviral medicine for COVID-19 in the US. And while effective, it is time-consuming, costly, and requires medical assistance to administer the treatment.
I am so excited about our special guest this week. We're going to move things around a little bit on the show and bump him up because I can't wait to ask him some questions. He is the current director of the California Department of Public Health, and as such, he is the man who passed down the controversial vaccine mandate for healthcare workers. We're going to get down to the reasons that he felt that was necessary, and we are going to find out directly if he and his vaccine agenda are part of the Illuminati. He has been in service to the community in a public health leadership role for the last 2 decades, including being the public health officer for the city and county of San Francisco before his current job as director at the CDPH. You've heard us report about his findings and quote his answers to other outlets, but tonight we get to ask our own questions, y'all. Welcome, Dr. Tomas Aragon, to the show. Hi, how are you doing tonight, doctor?
Oh, very good. Thank you.
We are so excited to talk to you. Let's just get directly right into it. In early August, you issued a public health order that made California the first in the nation to require vaccination amongst all healthcare workers. What motivated you to push for this vaccine mandate as opposed to keeping previous guidelines that allowed workers to choose between vaccination or weekly testing?
Yeah, so other health systems were moving in this direction, and in healthcare, healthcare workers in general have requirements to make sure that they protect the patients they're serving. So we have vaccination requirements, testing for tuberculosis, and so making sure that we take that ethical approach was really critical. And so it's really sort of it's the place to start. Other health systems were doing it. We recognized that this was something we really had to do to protect our most vulnerable patients, and then the staff as well. This virus is so incredibly infectious, especially with the Delta variant. That was the other new player on the block that just really had everybody pivoted and recognizing we have to take advantage of the amazing vaccines that we have. Very effective, very safe, and the healthcare environment. No one should ever go into a healthcare environment and get infected.
Mm. So, what has the response been since this vaccine mandate went out? Like, has it been difficult to work as a public health official at a time when many people are opposing vaccine mandates and
Well,
public health
it's
orders?
actually it's actually a small number that's opposing the vaccines, because most people in California are vaccinated. That's one of the reasons why California in general is doing better than other states. Even though we did have a surge, our surge was much smaller than other locations. And so most people are vaccinated, and most of the healthcare workers are vaccinated as well. So remember, when the vaccines first became available in December 2020, the first people to start getting vaccinated were the healthcare workers. So the vast majority of them are vaccinated. It's a small number that have remained unvaccinated, and so it's really been and most of those are actually getting vaccinated. So there's a small vocal minority who don't want to get vaccinated, but actually across the country, where other health mandates for vaccinating healthcare workers, the vast majority of folks end up getting vaccinated. So it ends up not being an issue in most places.
So, outside of the healthcare setting, there's also been concern about the virus spreading within schools. What current public health measures are in place to keep children and staff safe as they return to schools?
So what I tell people to remember when they think about how to stay safe, and I there's basically four things to remember, and the way that you remember that is just remembering the letters MTV. If you remember
Okay.
MTV, easy to remember.
They used to
Um,
play videos for those of you younger
yes,
viewers.
music videos. Yes. So M is for masking, and I'll come back and talk about each of them. M is for masking, T is for testing, and V stands for two things: ventilation and vaccination. Vaccination being the most important, highly effective, highly safe vaccines, and so we're very fortunate that we had an effective, safe vaccine so early into the pandemic. If we had not had a vaccine now, if we did not have a vaccine, we would be in wave after wave after wave for several years. And you look, when you see the number of deaths across the country, we would have many more deaths if we didn't have a vaccine. So ventilation is important in schools. And so this is something that schools need to work on, because not all schools have ideal ventilation systems. But opening the windows, opening the doors, if you can't do that, now schools have air cleaners inside the classroom to clean the air. Ventilation becomes a challenge sometimes because of air quality and wildfires, where you do the opposite, right? You want to close the window, close the doors, and so thinking about your ventilation system is really critical.
Mm.
And the facilities managers really know how to do that. Testing, the state provides free testing for all the schools that want to start up a program. So now they have antigen testing. My wife is a teacher in an inner city school, and so she has that experience. A teacher there, that specific school, the teachers get tested once a week. So having a testing program is really important. And of course, masking is really critical. Simple to do, universal masking, especially indoors. It prevents It limits the aerosols that come out if somebody's infected. And a good mask will also limit the amount of infectious inoculi that you would breathe in should you be exposed. One of the things you will notice if you compare California to other states, if you're watching other states like Texas, Florida, where the governors have prohibited masking in the classroom, you see much higher rates of kids being hospitalized, including in the ICU. In California, it's remained very low. And so we think part of the reason we've done that is because something as simple as just wearing a mask reduces the amount of exposure indoors.
Can I just ask you really quick about your mask recommendations? Is it the N95, the KN95? Is there one that we should double mask, cloth mask? Is there a recommendation you have?
There's really a gradation. At a minimum, people should be wearing a good mask. And actually, right now, based on evidence, the best mask there is actually not the best. I'll get to the best. But in terms of the simplest mask to wear would be a surgical mask. It turns out that the surgical masks are actually really good. And the thing is that you want it to fit tight on your face. And so you can take a surgical mask. You can do double masking on that. You're moving in the right direction. So those masks are good for a couple of things. One is, remember, the amount of aerosols that comes out is lower. If somebody's around you without a mask, and they, when people talk, they spit a little bit, right? It prevents some of that droplets falling there, and it limits the amount that you're going to inhale should you be in a room where somebody else has COVID. Even better than surgical masks are respirators. And respirators now are a little bit different. Those fit tight around your face. So the N95s, the what's it called? Well, yeah, N95s, K95s, and there's another one, KF94s. Those three are that fit tight around your face. And the reason they have to fit tight around the face is that they filter the air as you breathe in. And that's going to give you both limit the amount of aerosols that come out if you're infected, and limit the amount, because it filters air that you're breathing in through negative pressure. It filters any air coming in. That's really the best. And we tell people, if you're old, if you're at high risk for complications, if you're in an indoor setting where you don't know the status of other people in the room, especially if there's a lot of crowding, and if you want to protect if you want to increase your level of personal protection, then wearing a respirator is the right thing to do. So you'll see people, for example, in airplanes and in transportation, you'll see people that will be wearing those types of masks.
Absolutely. And thank you so much for that. That was really insightful and really helpful, because there are a lot of options out there. And also a bonus for our viewers, that the K95s will actually help with the fire smoke in California.
Yeah, so that's actually really, really important. So when there's a wildfire, the truth is that you don't know what you're breathing in, and the particulate matter, what's called the 2.5 and smaller, it's so small that you actually can't always see it. And so that's why the EPA has a great app. It's called EPA Now. It's called EPA Air Now. Download the app. You can check the air quality in your area, and it'll give you an idea of what the air quality is and what to do when the air quality becomes really poor. And so having those respirators, people are used to them now, just because of the wildfires of the air quality, and you definitely want to wear it when the air quality starts getting poor.
Beautiful. Thank you. Well, I want to get into vaccine myths and some of the things that are kind of getting in people's ways of getting vaccinated. But first, I have to ask you, are you in the Illuminati?
Am I in the Illuminati? No, I don't think so.
Okay, if you are, you have to tell me. That's the only rule here. So now we can get into, is there any myth regarding vaccination or mask wearing that you would like to debunk for our audience? We love to debunk things and to use the science here. Are there any myths regarding vaccination?
Well, there are I mean, there are myths out there that just don't make any sense. That like somebody's injecting a chip inside of you. There's myths like that, and then there's myths where there's just not good information, and that is, for example, people who are pregnant. So the vaccine is very safe. It's now been incredibly well studied. We've had hundreds of millions of people vaccinated. No medical therapeutic is always 100%. There has been a small number of complications, but they're incredibly rare. And what the scientists do is that they compare what is the risk of COVID and what is the risk from the vaccine. And risk from COVID is many times higher than the risk of vaccines. And so COVID is a very insidious virus because when it infects you, it goes after all your organs. It goes after your brain, your heart, your lungs, and your kidney. And so you see people get really sick. You see blood clots. You see people getting brain fog. You see strokes. You see people that lose their limbs because they get gangrene of the limbs. So it's a very insidious virus. And the other reason why it's insidious is that it it for most people, they will have a mild illness. You don't know if you're going to be the one that gets really sick. And when you do get sick, it comes down really hard. And people all of a sudden feel like they can't breathe. They feel like they're suffocating. So it hits really hard. And that's the scary part. So as you get older, complications, diabetes, obesity, immune compromise, you're more likely to have a complication.
And what are the biggest complications, the adverse reactions that people are having to this vaccine? Is mostly just it's us dealing with vaccines, right? It's us getting sick for a day or two.
Most of it is going to be local soreness in the arm where you got injected. You may feel like you have a flu for a couple of days. You have a headache. You just feel like you have a flu. When I got vaccinated, I had chills that night, but it went away. And then there are rare complications. So the mRNA vaccines, in younger adults, have been shown for a very small, very rare complication of what's called myocarditis, some inflammation that goes away. People do fine. The J&J vaccine has also a rare complication of a blood clot. But again, when people say, well, I don't want to get the vaccine because of blood clots. Well, if you get COVID, your chances of getting a blood clot are much higher than from a vaccine. So, for example, I had the J&J vaccine. So these outcomes are rare, and so people just have to realize is that's what we're facing. We're in a pandemic. You do not want to get the COVID, especially if you're at higher risk of complications.
Absolutely. Can I ask what were some of the deciding factors in going with the J&J versus the mRNA for you?
Well, at the time the J&J came out, first of all the vaccines are safe and effective.
Absolutely.
All of them are very effective at preventing the worst outcomes, which is severe illness, hospitalizations, and deaths. And so when the J&J came out, we knew from the clinical trial data that it was very effective, less effective in preventing infection, but very effective in preventing the severe outcomes. So some of us, we felt that it was important for us to sort of walk the talk and say that, we're gonna take the J&J. It's safe, it's effective, we're gonna get vaccinated.
Absolutely, and there's word that there may be a second J&J shot coming down the pipeline soon.
Yeah, correct. So that's so one thing I do want to say that they're all amazing vaccines, amazing technology. When the vaccines were first being developed, the goal was, let's hope that they're above 50%. That was the approval criteria of being approved for emergency use authorization. Nobody imagined that it was going to be 80, 90, 95% in terms of efficacy. So they're really fantastic vaccines. Vaccines over time, their protection wanes, protection goes down. Right now, the vaccines are holding up in terms of protecting against the most severe diseases. In terms of preventing infection, we do see waning happening, and that's why you see with the Pfizer vaccine, they are recommending booster doses for people who are above 65, people who have medical conditions that put them at increased risk, and so for those two groups, they should consider getting the Pfizer booster at least 6 months after they completed their primary series.
Beautiful. Thank you so much for all of this today and for sitting down with us. I have one last question, and it is the question I ask everyone who comes on this show because we stay joy hunting out here. Where are you finding your joy today?
Where am I? Oh, that's such an increase. That's a really good question. I think for me, it's been getting a good night's sleep. I can't tell you how important getting a good night's sleep. We have been, for us in public health, we have been going at this nonstop every single day since January 2020. So people have been working incredibly hard. And so these little moments where you get a good night's sleep, spending time with family, getting out and just getting some exercise, is how we get some of the joy back, because it's a lot of hard work.
That's one of the basics. One of the
Yes.
basics of that joy hunt. How else, you bring something up that I think is really important, talking about self-care. How do you practice self-care, and how do you recommend that people in public health practice self-care while managing through a global pandemic?
So I've been working in emergency management for a long time. I used to run a research center and a training center on public health emergency preparedness. So I've been connected to the emergency response field for a long time. And then in my health officer role in San Francisco, had the opportunity to respond to different emergencies. And one of the things I've noticed over time is that when people are in emergency response, what do? They eat too much, drink lots of coffee, eat snacks, and they just, because of the stress, it's the stress, they do that. And so I realized early on, when this happened, I was very intentional in recognizing that this might be a marathon, and so I really focusing on the basics, good night's sleep, good nutrition, physical activity, mindfulness, keeping it really simple. You have to be very intentional, because it's incredibly stressful, and it's really easy to develop bad habits. And I can see it when you go into these emergency response centers where they have donuts, they have
Right.
temptations that probably over time is not the best.
Right, absolutely. Well, thank you so much for that. Just so much information in here, and thank you for taking the time, and thank you for being who you are and doing what you've done for the last couple of years out here in California. We really appreciate you.
And thank you. And I haven't had a chance to listen to your poetry. My brother's a poet, so it's very special to me. So my family's from Nicaragua, so Nicaragua, I read the poetry.
So we'll have to have you back on to talk poetry.
Maybe my brother, Francisco Aragon.
Absolutely.
Okay.
Thank you so much. We will talk to you soon.
Okay, take care.
As kids return to school, we are seeing an alarming increase in youth cases of COVID, but are we seeing more hospitalizations or deaths from these increased cases? What are doctors learning about why the immune systems of the young seem to be more resistant to COVID? Here's the latest from Kaiser Health News, brought to life by Streamlab.
18 months into the COVID-19 pandemic, with the Delta variant fueling a massive resurgence of disease, Many hospitals are hitting a heartbreaking new low. They're now losing babies to the coronavirus. The first reported COVID-related death of a newborn occurred in Orange County, Florida, and an infant has died in Mississippi. Merced County in California lost a child under a year-old in late August. It's so hard to see kids suffer, said Dr. Paul Offit, an expert on infectious diseases at Children's Hospital of Philadelphia, which, like pediatric hospitals around the country, has been inundated with COVID patients. Until the Delta variant laid siege this summer, nearly all children seemed to be spared from the worst ravages of COVID, for reasons scientists didn't totally understand. Although there's no evidence the Delta variant causes more severe disease, the virus is so infectious that children are being hospitalized in large numbers, mostly in states with low vaccination rates. Nearly 30% of COVID infections reported for the week that ended September 9 were in children, according to the American Academy of Pediatrics. Doctors diagnosed more than 243,000 cases in children in that same week, bringing the total number of COVID infections in kids under 18 since the onset of the pandemic to 5.3 million, with at least 534 deaths. Experts say it's a question of basic math. But the latest surge gives new urgency to a question that has mystified scientists throughout the pandemic: what protects most children from becoming seriously ill? And why does that protection sometimes fail? This is an urgent and complex question, said Dr. Bill Capagiannis, Senior Medical Officer and Infectious Disease Expert at the Eunice Kennedy Shriver National Institute of Child Health and Human Development. We are doing everything we can to address it. Answers can't come soon enough. For much of the pandemic, doctors could only guess why children's immune systems were so much more successful at rebuffing the coronavirus. Despite the alarming number of hospitalized children in the recent surge, young people are much less likely to become critically ill. Fewer than 1% of children diagnosed with COVID are hospitalized and about 0.01% die, rates that haven't changed in recent months, according to the American Academy of Pediatrics.
For those of us who had the privilege of working from home during the pandemic, despite the stress of possible global apocalypse, we did get to enjoy not commuting or getting dressed up for work or having to wake up early. A lot of us rolled out of bed 3 minutes before our morning meeting and jumped on the Zoom before brushing our teeth or even putting our pants on. It was a break from some of the pressures of so-called professionalism. But for some of our Black and brown family, it was a respite from racism and the microaggressions of the workplace. Here's King 5 in Seattle with one woman's story, a story that we all need to be thinking about.
Wear the Mask by Paul Laurence Dunbar. There's a poem about the faces we share, the faces we show, which you display to people to be able to function.
Long before the pandemic, Tisha Held was wearing a mask.
We wear the mask that grins and lies. It hides our cheeks and shades our eyes while we wear the mask.
An invisible one.
Smile to hide the fear and the anger and the pain.
Every hour of every day she spent at the large financial institution where she works as an auditor.
You have to have these two separate lives.
Her life at home, where she was her whole self, and her life at work, where as the only Black person in her department, the mask rendered her a shadow of herself.
There's already an idea of who you are. You have to always be conscious of how you present to other people.
Hands up!
Am I being too loud? Am I fitting into very specific stereotypes? If I come in and say, I'm having a hard day. I don't even know if I want to be here right now because another Black person just got murdered. I don't think people really have the capacity to take on someone else's energy.
Would you call it isolating?
Most definitely.
It's an isolation that is painfully familiar to people of color in the workplace, from encountering racist jabs known as microaggressions to being overlooked for promotions. But some of that changed when the pandemic hit. A survey by the Slack think tank Future Forum found that Black employees experienced less stress and their sense of belonging skyrocketed 50% once they started working from home.
Slack survey finds 97% of Black knowledge workers want the future of the office to be remote or hybrid. Not surprising. I think people having gone through this past year and experiencing the constant cuts from microaggressions and the fatigue of living through the pandemic are just tired. And to go back to what they knew after having experienced some level of relief, don't want to go back to that.
For Tisha, working from home wasn't just an escape. It was a chance to be herself.
It was great to be in this sea of people.
To march with her family after George Floyd was killed.
Wanting to see change.
To unmask herself at work.
I volunteered and said, at where I work, I would like to do this. I wrote an article. The title of the article is Why is Self-Reflection Not Enough? Self-reflection is not enough if you want to be an ally.
What was it like bringing that part of yourself to your professional environment when that's normally not something that you do?
I think it was that gate that needed to be opened. I do a lot of things outside of work, but then doing it at work really did help me bring more of myself forward because I don't want to wear a mask. I do want to be my full authentic self. I want to be able to show up in any space with any person and be Tisha 100% all the way through.
That Slack study concluded, in order to give Black employees a greater sense of belonging, employers should embrace flexible work as part of their central principles of diversity, equity, and inclusion.
There's diversity in our jobs, but there's a lack of inclusion. And stop just looking at the surface, but doing more self-interrogation because that's going to be uncomfortable. And then they got to figure out what those gaps are to push past it.
If you have a nose and lungs, you know that it is fire season in California. And if this isn't your first one, then you know that they have been getting progressively worse for a while now due to a highly debated truth known as climate change. What can our policymakers even do to fight such a big issue? And what changes are they currently working to make? Because this affects all of our health. Well, Governor Newsom this past Thursday signed off on the largest climate plan in state history at $15 billion.
With fire and smoke choking our skies.
So with that,
Governor Newsom signed a $15 billion climate package in the Sequoia National Forest, where wildfire forced them to wrap trees and other structures in fireproof tin blankets.
an unprecedented investment into our kids' and grandkids' future. If not now, when in the hell are we going to do it? What more evidence do you need of a world that's heating up and our kids that are choking up?
The package includes money not just to fight fires, but also to fight fire risk, something Bay Area environmental groups say is key to end the scenes of smoky skies and communities gutted by wildfire.
And my hope would be that there would be at least as much emergency resources continued to be utilized on mitigation, in addition to all the resources we're going to be forced to expend on adaptation.
The focus today was largely on forest land, which Newsom points out is 57% under federal jurisdiction.
All the folks in Washington, D.C., I hope you're paying attention. This is real. We need you to put down the swords, rhetorically and otherwise, get the damn job done.
The money will also go towards, among other things, drought abatement, the building of high walls to repel rising seas, and increased promotion of electric vehicles.
And that's another episode of Masked Up Down. As always, it is our extreme pleasure to bring you conversations with some of California's leading health minds and dispel some of the wildness that the internet is so ripe with. We want to thank our guest, Dr. Tomas Aragon, who is confirmed not in the Illuminati, as you saw if you watched the interview earlier. Make sure you go check out the sites he was talking about. And for the rest of the Masked Up team, I'm Andrew Defy. We'll see you back here in 2 weeks. Health is wealth, y'all. Get your bag.